Now, health equity is all the rage. It is the hottest thing. And it actually, in some ways, I have a really hard time because not everyone who talks about health equity understands or is actually doing something to move the needle. When we think about health equity, it's not just that maybe our services are in Spanish or French and that we're making ourselves, a little bit more accessible. That's one piece. And that really talks, right, to the literacy component. Can people read, write, understand what I'm saying? But health equity is so much more. It really involves looking at the systemic barriers. So when we talk about the actual knowledge, knowing what your rights are, knowing how a system works and how to adjust or move through that. And so I think that when we think about, kind of how this all plays in right now, I think there are a handful of companies and a few more on the way that are led by people who have lived experience. And I think that's one of the big things that I always look for. Do you know what you're talking about? And do you know how this impacts, right? And if you don't, that's okay, because you can still be an ally. You can still come alongside us. But I really look for who has lived experience, who's doing this and understands it. There are a few companies coming through that are really centering this. And I think we're right at the beginning, right? I think a lot of old companies have pivoted to health equity, but I think we're right at the beginning. It reminds me of the early days of health tech, where we're going to see a lot more folks, a lot more companies coming up and really opening the doors to see, again, new innovations that really encompass this idea of intersectionality, that encompass the idea of working together and creating real solutions that are built by and for communities that have been often ignored.